most of the time the engagement rates in the healthcare industry are from like 1% to 3%.
Yeah, it's pretty dismal.
It's trash. I mean, I don't want to have a relationship with my healthcare plan.
I don't want to be sitting in the hospital and feeling shitty and have to fill out a survey.
No.
On a clipboard.
It doesn't work. Or I have to sit down with a care management nurse for 2 hours for them to figure my life out. It wouldn't be great if I could just essentially put the bits and pieces of this together over time in an iterative format that's really beneficial for me and meets me where I am.
Yeah, and I get paid to do it.
Oh, super cool. So in the stance of healthcare, like one of the big things in one of our recent case studies dealt around things called notice of pregnancy. So just being able to understand when someone is pregnant, okay, who that member might be for a healthcare plan, that allows the plans to then curate risk amongst that group and say, what resources can we get these mothers right now?
Yes.
Because
100%.
the outcomes of doing that early treatment and awareness and education around pregnancy reduces admissions into the NICUs, reduces long-term hospital stays for mothers post-birth. And so if you think about the chain here, if we can connect and engage with people, collect the data that we otherwise weren't collecting because our engagement rate sucked, and use a tool that helps get better outcomes from mothers and their babies and reduce hospital costs.
Yes.
Who wouldn't want to do something like that?
Yeah, 100%. And that's why we have some of the largest healthcare providers hopping on.
That's correct.
Finance, I want to get into this one. I think this is really cool. Improve risk assessment, detect fraud, and create tailored finance products. Before you go off, I want us to kind of go emerging markets, detect fraud in the finance industry. And then I know a lot of these financial institutions are using AI. How can we help their AI?
Okay, so typically, all right, when you're trying to determine risk, risk with Western banking laws says that if someone's in a specific country, they're high risk and they're immediately cut out of the system. We're not going to let them participate. So this makes it very difficult for people in economically developing nations to be a part of essentially the global banking system itself.
Yes.
And find opportunity to get credit and open up bank accounts and do all that other good stuff. Now, with Tartle, because we have the ability to get into those difficult areas on planet Earth and source data from these human beings, you have the ability to assess risk based on their habits, based on their intentions, asking them to share documentation that was otherwise paper documentation, but share it to you in a digital format that you couldn't find anywhere else.
I love that. Yeah.
And so now when you do that, now you can actually start to build individualized risk models for those people.